Welcome to Vaso-Meditech EECP Treatment Center. Today in this video, we are going to discuss about cholesterol. So when we say cholesterol, everyone thinks cholesterol is bad, but not all the cholesterol in our blood is a bad cholesterol. So we do have some cholesterol which is called good cholesterol. And with that, in this presentation, I'm going to answer one of the common things posted by the patient. Because most of the patient, when they identify to have a heart disease or blockage in the blood vessel, then the first question is, doctor, is anything you can do to remove the block from my coronary arteries or the blood vessel which is carrying blood to the heart muscle? Now, most of the time, we tell the patient that it's not possible. Whether we are doing a bypass surgery or stenting or EECP, we may not be able to remove the block, or we don't even attempt to remove the block. But what is the real answer to this? Because we don't have much time to explain to the patient in the consultation room. So I try to explain the detail about why we're not able to remove the block in this presentation. So as I said, all cholesterol is not bad. So when I say bad cholesterol, this is called LDL cholesterol. So the bad cholesterol LDL, what it does is, it carries the cholesterol and deposits into your blood vessels. So eventually the deposition grow and block the entire vessel and causes heart attack or chest pain. But there is another cholesterol in your blood that is called a good cholesterol, which is a HDL cholesterol, or we call as a high density lipoprotein. This cholesterol has an opposite effect. So what it does, it removes the cholesterol from your block and then carries the cholesterol to the liver, where the liver metabolizes this cholesterol and secreted through bile through your gallbladder. Now, when we ask about whether when the HDL you can able to remove the cholesterol, is that any way we can able to remove the cholesterol, same thing like the HDL does. There are many trials which done. In fact, they use niacin and multiple drugs which could able to increase the HDL level artificially. I mean artificially because we take certain medication to increase the HDL level. But eventually, when you increase the HDL level, and there is specifically one drug called cholesterol transferase, which is a protein inhibitor. This drug does increase the HDL level significantly. But unfortunately, even when it is increases the HDL level, there is no change in the heart attack risk or death or stroke. So even when you increase the HDL level, it is not possible. So removing is not a good option. But the study didn't stop there. There is another study. What they did is they used a protein called CSL112, which is a human plasma derived apolipoprotein A1. So what they did is, if we can able to increase the HDL, still we are not able to reduce the heart attack risk, and there is another way to improve the quality of HDL. So what is the quality of this high density lipoprotein or good cholesterol? The quality means what they did is they increased the protein in the HDL. So this protein is an important component of removing the cholesterol from the blocked arteries. So if you can improve the protein, then they thought they may able to reduce the cholesterol in the block and eventually can able to reduce the heart attack risk. And this answers most of the patient question. Yes, they did try to remove the cholesterol from the block so that the block can regress. But even this trial significantly failed. They did not show it removing of the cholesterol from the blocked artery can able to reduce the risk of heart attack or a cardiac death or stroke. So this leaves something of a difficult position, because for all this time we claim that the block is a main reason is a cholesterol particle. But scientifically, with the evidence-based medicine, when we remove this cholesterol, it failed to prevent heart attack and death. So this cholesterol hypothesis, that block removal, which most of the patient ask me, is not a solution to prevent heart attack or death.
இருதய நோயாளிகளுக்கு bypass surgery angioplasty சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. சோ இதற்கான மாற்று சிகிச்சை முறை EECP enhanced external counter pulsation heal your heart Vaso-Meditech EECP treatment center.